Our first section today concerning with the introduction and the diagnosis of the pulp therapy in primary and young permanent teeth. All of us know that there is a morphological and developmental and physiological differences between primary and young permanent and permanent dentition and young permanent dentition, which lead to special treatment modalities affecting different technique and material will be used. As all of us know that the primary teeth undergo root resorption and it has what's called lateral canal and apical ramification nerve bundle. As we've seen here in front of us, this is a cone beam cutting of the primary molar teeth. This leading to different approach, different materials, and different psychological approach and different treatments. So that all of us know that there is exposure of the pulp and the primary teeth caused by either is dental caries, which is the most common, all of us known, iatrogenic duodenal cavity preparation by the dentist, or trauma, especially in the anterior teeth, primary or permanent or young permanent teeth. So that by default, early and careful management of any caries, specifically any deep caries lesion in primary teeth, is quite important to avoid pulp exposure, by default inflammation, subsequent necrosis, periapical abscess, and pathosis in this periapical area under the primary teeth, which is the most important organ, which is the permanent successor, which is our goal to preserve both primary and permanent successor. So first point is in this section is the diagnosis modalities, diagnostic modalities used in selection of teeth for pulp surgery. First of all of us know history of pain. There is two types of pain, either provoked pain or spontaneous unprovoked pain. Provoked pain is perceived by stimulus and disappeared once the stimulus removed, whatever hot or cold or functioning, which is give us a good prognosis that the pulp in healthy, good condition. However, the spontaneous unprovoked pain is a constant throbbing pain, whatever the stimulus is persistent or not, which is give us a poor prognosis or a negative impact that the pulp condition status is poor. It's very important during taking the history with the child or the parents, taking the history of pain. However, it's very important parameter during diagnosis, but it is considered unreliable tool. Why? Because the children may be unable to express pain. He's very young, he cannot express pain, or in case of pulpal degeneration necrosis, there is no pain expressed. So that the history of pain, all of us know the history of pain, it's an important taken in consideration, but not only as a reliable tool, decide upon it which technique will be used, which approach will be used with the tooth. Second point, through clinical sign and symptoms the selected tooth should be examined well, buccal, lingually, surrounding mesial distal from all the parameters. If there is abnormality, as we see here in the photo, abnormality sensitive to percussion may denoting or meaning there is a periapical pathosis, presence of swelling, sinus buccally, drainage fistula, chronic abscess. This gives us a negative impact or a negative image about the pulp status. Also, radiographic examination or interpretation, periapical or right wing may be used to examine the periapical and supporting, and maybe most of us using the extraoral digital panorama may be used also to view the condition of the affected tooth. Fourth parameter is the vitality test. All of us know that we have two types of vitality test, either thermal or electric. Thermal is more accurate, either applied heat or cold heat, either by hot Gutenberg of hot instruments, either cold by ethyl of chloride. This is very important. Either the guideline tell us to examine the vitality test, examine first the normal tooth, and then come to the affected tooth. Either it give us the pain is persistent, denoting is a premic pulp condition. If the tooth does not give any response in the case of the thermal, denoting a non-vital pulp condition. Electric, all of us know electric, recording the reading of the normal tooth. Affected tooth, either it's affected at the normal or at a higher, at a normal, less than the normal, maybe denoting that pulp hyperemia, and the affecting, if this is not give a recording higher than the normal, meaning the pulp degeneration. For the guideline tell us here in the either electric or thermal pulp tester, the drawbacks of the electric pulp tester with the pediatric patients. Number one, become apprehensive. Get that you have make an examination to the child, getting a device approach to him, producing a device, producing a sound, so that your child become apprehensive and give a false positive response. Second point, which is very important, scientific-wise, which called the liquefaction necrosis. All of us know that the necrosis, we have coagulative or liquefaction necrosis, degeneration of the cells, give us a liquid. Maybe this liquid transmit the electrolytes or the from to the device, so that give us a false positive, although that it is a negative or degenerated pulp. So that if you have a choice during diagnosis of a child of vitality of tooth in this child, either thermal or electrical, go to the thermal test. Fifth point, which is seriously ill children with advanced medical problem, heart disease, nephritis, leukemic, a child with the tumors, all of this have their immune system lack of the regenerative power. By default, their pulp of the teeth lack of any regenerative power or response to treatment. So that by default, extraction of the involved tooth after proper pre-medication. So we have 5 points, mainly 4 points should be considered during diagnosis before starting any pulp therapy in primary young permanent teeth. First of all, history of pain. Number two, clinical examination, radiographic examination, and vitality test. 1 point should be considered at the first of the course of our course. What about the general contraindication from the beginning? What about the general contraindication for pulp therapy and for primary teeth? Patient with unfavorable attitude toward the dental health by default, ignoring the visits, ignoring the treatment, poor general health by default, reflecting on the oral status. Number two, a tooth close to natural exfoliation, for example, 10 plus or 11 plus by default for primary molars. It's not indicated for pulp therapy or restorative treatments, should be shed or should be extracted. A tooth with a caries penetrating the pulpal floor, as we've seen here in the case of pulp polyp, for this tooth indicated for extraction. Tooth with a gross breakdown, that the restoration would be impossible following the pulp treatment. Thank you.